Mediheal Group of Hospitals, to be the most responsive, innovative healthcare provider, plus positively impacting communities in Africa and beyond.
600 million people are suffering from the kidney disease across the globe.
People out there are really suffering in silence.
Some part of the world, the technology and the treatment, all advanced things are available, but some part like the Africa and some part of the Asian countries, it is not available.
If we went to India, it would be even triple the expenditure.
We are able to provide the middle class and the lower class people who are suffering, they cannot go abroad for the advanced treatment.
I had a very easy time convincing my family of the adept Mediheal that it is the same way like bringing India to Kenya.
I was optimistic that a solution was going to be found.
It is about having trust and faith.
This is an open door for very many people who think that the solution is out there.
It is here at home.
Kidney-related mortalities and morbidities are widespread.
Health is undergoing many challenges because of the environmental issues, the population growth, the adulteration of the food. In spite of great technologies, very aggressive and skilled personnel, and also sophisticated and advanced infrastructure, till the disease prevalence and its severity is a great challenge to all of us.
The data shows worldwide it is between 10 to 14% of the population, world population, have some kind of kidney ailments. So in long term they lead to chronic kidney disease.
Coming to the Kenya also, it looks 4 million people are affected with the kidney disease. And every year about 8,000 people are getting added as a new cases to this kidney disease patients.
This has necessitated the need for an evolution in the healthcare landscape worldwide.
Organ transplant is now the real answer, appropriate answer to these organ failures. Out of 100,000 kidney dialyzed patients, minimum 60% need kidney transplant. So the question is, do we have that answer?
On this World Kidney Day, Mediheal Group of Hospitals is standing to be counted as a medical care unit that will offer transformational world-class healthcare to humanity.
My father had been hospitalized, discharged, and again back to hospital. He said, no, let's get a different opinion.
After going very many places, very many hospitals, my daughter came to Mediheal. It is then that my daughter asked what is required of a donor.
I've never really imagined that at one point in life I would even think of donating a kidney.
We came to a conclusion and said, if Winnie is ready to donate, let her go on. Then if it goes ahead and she does not qualify, then the second one will come, the third one will come, up to our 7 children. So all of them, they were ready to donate for their father.
Children donating to the parents. Whoa, that is something, it takes courage.
When the patient, a chronic kidney failure patient comes for surgery, that is kidney transplant, we evaluate thoroughly every system.
Our job is just to identify and assess properly, but to administer and then carry it out. So the whole team is needed.
We try all our means to take all due precautions so that we have a good outcome.
Then the day came. The only thing I recall is that I whispered a short prayer to God. I said these words, God, handle the fingers of the doctor so that he does a good work.
It involves 2 operations simultaneously. We have 2 teams of surgery. One side we do the laparoscopic donor nephrectomy. Our nephrologists, the anesthesia team, the nurses, they are well expert in this process.
Most of the sophisticated patient monitoring facility is provided for us to work.
It takes around 4 to 5 hours for the recipient and 1.5 to 2 hours for the donors.
I only came to discover the following morning at 9, asking, why don't you do the surgery for me? Only the sister told me that we finished yesterday at 9.
After the surgery, patient outcome is very successful, very satisfactory.
They want to not just be alive, they want to be productive. So the support for this patient's life is a continuous process for us.
We are doing around 4 to 5 per month and all our patients have gone successfully.
Mediheal Group of Hospitals is playing its part in ensuring that the critical part of the Big Four agenda, and that is universal healthcare, becomes a reality.
Nashukuru sana kwa hayo yote mlifanya. Nasema asante.
I just want to appreciate the Mediheal family. You've saved us, you've saved humanity, and we are very grateful. May God bless you.
I wish the world will see the great job you are doing in Kenya.
It's a great privilege to be associated with Mediheal Kenya. Dr. Mishra is a visionary. He is starting transplant in a big way in Kenya.
Kidney disease can be preventable, so please, we have to lead a disciplined life with proper diet and nutrition.
Mediheal Group of Hospitals, meeting every need of their patient with care and compassion. Accessible, affordable, state-of-the-art healthcare. Support health, support life.